Welcome to the Prescription for Admission podcast, where we talk about hospitals and hospital-based care, who you can expect to meet, and what you may experience during your time in the hospital, both as a patient and also as a healthcare provider working in a hospital. My name is Dr. Monique Nugent. I am a practicing hospitalist and also the author of Prescription for Admission, the book, where I talk about many of the same topics. Thank you for joining me and enjoy the show. Hi, and welcome back to the Prescription for Admission podcast, where we talk about hospitals, all things hospitals, and trying to give you some information so you know how to navigate hospitals and healthcare systems. I am your host, Dr. Monique Nugent, and this is our New Year's episode. So it's just me again. I really want to take this time, an episode, to spend giving thanks. 2025 was the year that I launched the Prescription for Admission podcast. I wrote the book in 2023 and spent some time trying to figure out what were my next steps and how to continue this mission of teaching you about hospitals, healthcare systems, and really the systems within systems that exist for your care when you're hospitalized. And I'm going to admit it took me some time to gain the confidence to launch a podcast on my own. Even though I had been on a few podcasts before and really enjoyed the experience, the idea of carrying this and planning this and producing this on my own was not only daunting, but I still had a lot of feelings of, is this something people want to listen to? And the answer has been yes. And thank you so much to all the people who have joined in and listened. Season 1, I was really proud of, and I really want to thank everyone who participated. And I'm going to go through and talk about everybody who's participated because it's been such a great group. But season 1 really gave me kind of a stronger foundation to understand what this experience of creating a podcast and bringing you the information that you want and need is, and how to move forward. And I will admit that a lot of the people you heard in season 1 were friends of mine, because I have a great group of friends who knew that I was doing this and wanted to be supportive, but also really wanted to give you the information that they had. They all felt really strongly that they had something to share that you would be interested in. And I'm really thankful for that. And season 2 just wrapped up, and season 2 is really strong as well. And we got more into the experience of not just who you meet in the hospital and how we work, but all of the things that it takes to support you inside and outside of a hospital, and aging, and how to advocate for your family. So this has been a really great year, and I'm extremely thankful for everybody. I'm just going to go through really quickly and talk about some of the great episodes. We started off really strongly with Dr. Charlie Ray. Charlie is a friend of mine from residency, and he's out there in San Francisco. He is a fellow hospitalist. He writes about hospital medicine, does research, he teaches. I couldn't think of a better person, a stronger person to start off a podcast about hospitals than with Dr. Charlie Ray. And he brought us some really great information and perspectives about the fact that we all work in a team in a hospital. Caring for you is really about how we as a team work together, and that he sees himself as a quarterback for the team. And the big wins of placement and rehab and things like that are not things that we as physicians can accomplish on our own. These are things that really require professionals who know the systems, who know the things that they do really well to support patients. And so a big thank you to Charlie for starting me off strong, and also for being a huge supporter of me, because I know I had reached out to him after a few years and he immediately said yes. And again, to have that support from your friends in the field is extremely important. We also heard from Dr. Tola Johnson in the emergency medicine department. And emergency medicine, and I want to spend some more time over the upcoming years talking about emergency medicine. Emergency medicine is really the door to the hospital, and oftentimes it is the face of the hospital. The way that people think about hospitals, they think about going to the emergency department first, and your experience there. And I really enjoyed her insights as to what the triage system is and why it's important for patients and families to understand what triage means and what that might mean for their experience and when they see a physician in the emergency department and what that physician says about whether they are safe to go home or if they need an admission. And that was really great. Another really wonderful group of people I want to really shout out are our pediatricians who have joined us. So I am not a pediatrician. I'm an internist. I treat adults, but I am a mom, and I am a mom who has had children in the hospital. I am very blessed that my children have come through whatever reasons they were in the hospital pretty well, fairly unscathed. But I am a NICU mother, meaning that my child was born prematurely and spent some time in the neonatal intensive care unit. I did have a child in the pediatric intensive care unit for a short amount of time. And I've had to go to the emergency department with my children. And I will say that as a mom, as a doctor mom, you think you know things. You think you understand the system and that you're going to walk in and you're going to be the person who can advocate really well and navigate really well. And above all, you are a mother, you are a parent, you are a guardian, you are a caretaker. When you walk into that emergency department, that doctor's office, that hospital, that intensive care unit with your child, you are, above all, their parent. And for some reason, you think that your doctor skills or your navigating skills are going to trump that, and they don't. And I was just as lost as a parent in navigating the hospital system and knowing who was who and how to advocate for my child as any other parent was, or I should say, might feel. And so I have really valued the voice of our pediatricians who have joined me on this podcast. Dr. Elisa Khan gave us some really great insights on how we communicate and talked about her studies of communication with the medical team. We had Dr. Christy Goodson, who is a pediatric hospitalist, my sister hospitalist. And, she talked about the fact that caring for a child in the hospital is really caring for a family and understanding what a family can do and support in the home and how you can advocate for your child. And Dr. Nakia Jacobs Pratt, our pediatric intensive care physician, I loved her message that, intensive care for pediatric patients is intensive care, that these are children who need really complex medical supports and that parents and the medical team have to work together. Parents are the first advocate. We need to listen to parents. We need to understand the value of what parents are bringing, and that if a parent is saying things just don't look right, we need to be hearing that and really partnering with parents. And Dr. Evan Nadler, our surgeon, yes, children need surgery too. And he wrote some really great insights into the fact that the world of pediatric surgery is small. And depending on where you live, it may be difficult to find a pediatric surgeon, and really lean on your team, your pediatrician, if you need a pediatric surgeon to help you find somebody if one isn't close by. But that it's a small world, and we have to support the training of pediatric surgeons to be able to go all over the country and support our patients who need care. And so really a big, big thank you to our pediatricians. And I really hope to bring more voices of pediatric care to the Prescription for Admission podcast, because like I said, as a mom who has had to navigate hospitals with your child, I know firsthand that it is not only scary and overwhelming, but everything moves so quickly that you are trying to care for yourself and you're trying to care for your child and you're trying to navigate, and it just kind of goes over your head sometimes, and you are your child's first advocate. And I want to bring that message over and over again and give people some information to get through those really difficult hospitalizations with their children. So thank you so much to all our pediatricians. And speaking about navigating and advocating, we were joined by some really strong voices of patients and families. Mr. Hollis Pierce joined us all the way from Canada to talk about what it's like as a medically vulnerable patient and living in a long-term care facility and also his journey about becoming a patient advocate, becoming a voice not just for himself, but for patients like him around Canada who require high levels of support and also really want to live life on their terms, and their support systems being able to help them with that and how they can really use their voice. It was a powerful episode. It was wonderful to hear from him. And I really am very thankful that Hollis joined us for a really great episode because I learned a lot. I always thought the idea of a medically vulnerable patient was that the patient themselves was the person causing the vulnerability. And when I say it out loud, that sounds really twisted to say like, oh, you're vulnerable because of your medical condition. But it's really that the systems outside of the patient doesn't support the patient well and is causing the patient to be vulnerable. And I love that message that it doesn't matter who you are. If you have a voice, you can use it and you can live life on your own terms as best as possible with your support system. And Hollis, thank you so much for joining us for that episode. We were also joined by Lisa Braxton, who had the experience of caring for her parents through hospital stays while she was at a distance. That is an experience that more and more people are having. Here in the United States, a lot of us grow up, go away for college or work or get married, or just because you want to be in a different place, you want to grow. There are lots of reasons people move away from their home. And as you get older, you're growing and having all these great experiences, building your life, while simultaneously your parents or whoever was caring for you when you were growing up is also getting older. And there comes a point where sometimes you need to step in and you need to be a support system for them. And as a hospitalist, I see this happen over and over again, that adult children live several states away, but are advocating and participating in their parents' care. And she talked about that experience of advocating from a distance and leaning on technology, which I thought, hey, that's a really great message. One that we should all kind of be leaning into pretty readily, that we should be using the tools we have that we use to make connections with one another, to continue to make connections with the medical team, and to continue to be a part of our elders' care. And Lisa gave us a really great story about how she and her sister were able to help her parents navigate their complex medical needs through a hospital stay. It was a wonderful story, and I'm so thankful that Lisa was able to join us. And we also were joined by, on kind of the same level, Sarah Eckline, who helps care for solo agers. She's a fiduciary who helps people make decisions, or I should say, help support patients by making decisions aligned with their wishes, and really helping people who may not have that support system in friends and family, or may seek it outside of their friends and family in a more official capacity. And she has such a passion for her clients and such a passion for helping people in places where they can be on their own terms. They can be supported with their medical care and their wishes on their own terms. And she was just a wonderful, wonderful conversation, and I loved it. And she gave us a really great movie. I know I ask all of my guests for movies or books at the end of their episode. I would say her movie stood out to me. That movie was called I Really Care a Lot, and that's on Netflix, about a fiduciary who was doing it really poorly. And it was a ton of fun. That movie's really great. I would say definitely watch it. And like she said in her episode, watch it and say, like, that is a bad example. That is not what should be happening. But it highlighted some really great points, that people who maybe do have nefarious intentions sometimes take advantage of our elderly patients through manipulating crisis. And that by being as prepared as you possibly can through making sure your wishes are known, through having a dedicated healthcare proxy, through having someone like a fiduciary, being a support system. If you can't speak for yourself, that really is one of the major ways you can protect yourself. So we should all be thinking about how we are supported well in advance of actually needing that support. That was one of my most fun conversations. So Sarah, thank you so much for joining me on that episode as well. And then staying in the line with supporting patients, I would say our episode that probably had the most listens was with Gina O'Hara, our case manager. And that just showed me that people are hungry for the information of straight up navigating this system. Case managers like Gina are the ones who help patients and their families successfully get out of the hospital and get the things that they need. So when you come into the hospital and you spend your admission time with me as your physician, our goal really isn't just about getting you better. It's about setting you up for success at the next step, right? The next place you're going to go. Is that home? Is that a rehab for a physical rehab? Is that a long-term care facility? Is that your loved one's home to care for you? Is that a hospice facility or a home hospice facility? And Gina has a really wonderful career arc where she's worked not only in hospitals as a case manager, but also with an insurance agency. And, she gave us some great insights to the fact that your insurance agency will provide you with a case manager. Your insurance agency will provide you with someone to help you navigate your way through these things. And you don't just have to be hospitalized or in the doctor's office to have access to a case manager. You can go ahead and call your insurance agency and say, hey, I need somebody to help me to navigate and understand how I can get the things I need to be successful for me or my loved one who I'm caring for. Gina's episode was our most listened to episode of season 1. And I know why, because she brings a wealth of knowledge and it's something that people are hungry for. So you're going to be hearing more from case managers and people who help you navigate the system as we continue to grow this podcast. And so thank you. A big thank you to Gina. Again, another friend of mine who I've worked with for years. And when she found out I was doing this podcast, she at first was like, I don't know about podcasts, but because she wanted to be supportive of me, she went ahead and she did it. And that to me was great. And again, I'm just so thankful for my support system and my friends who with me on this journey and supporting me in helping to get you guys the information about hospital stays. And so thank you, Gina. And if you haven't heard her episode, go back and take a listen to that episode. And I mentioned hospice and home hospice really quickly when talking about Gina's episode, which to me leads right into another really powerful episode. And that was with our death doula, Amy Yonick. Amy opened up season 2 with me and we talked about talking about death. And it's not something clearly that everyone is excited to talk about. Even when people have to have those conversations, they're not excited to talk about it. Family members are not excited to talk about it, support systems. And that's understandable. It's talking about losing someone you love, losing a piece of your family, your heart, your friends. That is hard and that is painful. And it is a part of life for all of us. And Amy gave us some really great tools to understand how we can have these conversations. And like she said, just because it's raining, it doesn't mean you're not going to get wet by not talking about the rain, right? The rain is real. Death is unfortunately something that's going to happen to all of us. And not talking about it doesn't make us invincible. It makes us unprepared. And so having the conversation over and over again takes away some of that discomfort, some of that ick. Having the conversation in small bites makes it more digestible and manageable, but also allows people time to reflect and come back and say, hey, actually, I thought about what we spoke about. I want to revisit that. That was another really, really powerful episode. And I encourage you, if you haven't heard it, go back to the episode 1 of season 2 and take a listen. Amy was a wonderful, wonderful resource. And thank you so much for joining us. So this has just been really great. Other people who've really brought a lot of really great information. My close friend, Dr. Nyota Pia, she was our psychiatrist, and she's also the psychiatrist who contributed to the book, Prescription for Admission. So if you pick up a copy of the book, you have Dr. Pia's words directly from her as well. And she talked about how being a psychiatrist in an acute care setting is really also being another advocate for the patient and helping patients and families navigate the mental health crisis that's happening while the medical crisis is happening. And oftentimes she talks about informed consent. She talks about if someone has the understanding and capacity to make decisions with patients and families and the medical team, and how she's that bridge oftentimes between the patient and the medical team when there's questions about how clear someone is able to understand and think when it comes to making decisions. But she also spoke about the fact that mental health crisis doesn't just happen during an acute hospital stay. Sometimes you're not having a mental health crisis during an acute hospital stay. You may be having an acute medical issue, so you want to keep up with your medications and your mental health during that time so that you don't cycle into a crisis. Another wonderful, great episode, another great friend of mine, and I thank you so much, Dr. Pia, for joining me not only on the podcast, not only the book, but every time I tap you on the shoulder and I say, hey, I'm doing something else, or hey, I have this idea, you have been nothing but supportive over all these years. So thank you so much. I live in the Boston area, which is full of really brilliant medical professionals and students and lots of research. And somebody who I met during my time here was a Mr. Scott Brizard. He was our pharmacist who spoke to us about inpatient pharmacy. And this was, to me, an episode that I immediately had on the top of my mind, because our pharmacists in the hospital are our safety net more than people realize. And he really touched base on that it's really important for pharmacists and the medical team to work together very closely to keep patients safe. And that was just a really great episode. Scott is wonderful. He's very brilliant. He is a leader here in the Boston area amongst pharmacists. And it was a really, really powerful thing to me to have somebody join us that early on to talk about safety and to talk about the fact that medication safety is one of the most important things that we can focus on during a hospital stay, and how patients and family can understand how important it is for them to also know their information. The other thing Scott talked about was the formulary. And that is a word that we who work in hospitals know, but I was excited that he talked about it really quickly, because I don't think people realize that even hospitals have a limited amount of medications and types of medications that we have. A lot of the times on TV, it makes it look like pharmacies in the hospital are this like magical catch-all that has even the most rare of medications. And that is not the case. Pharmacies in the hospital are limited to things that they contract with, and we call that the formulary. Yes, the formulary in the hospital is much larger than clearly, you have at home or the doctor's office has in the clinic. It has to be able to support patients from every walk of life, right? From the emergency department to the ICU, pregnant patients, children. So there's tons and tons of medicines. But amongst that tons and tons, it's not everything. It is limited. And you may find that your hospital doesn't have something that you use if you use a pretty specific or rare medication. And then speaking about advocacy, we were joined by Julie Seamers, and she talked about safety. Again, advocacy, safety, and how safety is really all of our responsibilities in the hospital, and how you as family members and patients need to be aware of the safety issues in hospitals, everything from medication safety to your physical safety, slip and falls, and that you should use your cuss words. Those are great, right? I'm concerned. I don't understand. And is this safe, right? And so this was a really fun episode for me, but also right along with the mission of safety and knowledge and giving you everything you need to know about hospitals and hospital stays. So thank you so much for joining us for this year, 2025, in the Prescription for Admission podcast. This has been a really great learning experience for me. And I want to hear more from you guys about what you're looking for in the podcast. People have been really great to reach out and say, love this. Give me some more patient stories. Give us some more information about safety. And I really also want to thank you, my listeners, for joining and for giving me the opportunity to do what I love, which is talk about hospitals and teach people about hospitals. And then also to show me that love that, yes, you're there, you're listening, and you want more of it and you're invested. So I'm so thankful. I'm so happy. And as we go into 2026, there are going to be some changes, but the thing that's not going to change is that I'm going to continue to bring you the information that is consistent, that is high quality, the experts who know what they're talking about, who can support you, and the topics that you are interested in and the topics that you're hungry for. So going into your 2026, I'm hoping that 2026 brings you joy, brings you love, makes you whole, and that you have some time to spend with your friends, your family, the people who value you, who you value. We all run at a frantic pace. The one thing that I really wish for everyone for 2026 is to slow down. So thank you all for joining me for the Prescription for Admission podcast. This is Dr. Monique Nugent. This is a podcast where we talk about hospitals and all things hospitals. And we're going to keep doing that in 2026. Have a happy new year.